Welcome to yet another edition of Maisha ni Health. My name is Fred Indimuli. Now, today's episode comes to you from the county of Nairobi. Our focus tonight is on mental health issues. We'll be talking to the residents of Nairobi and we'll bring you real case studies of people living with mental health issues. Later on, we'll be hosting a panel of experts and wananchi to discuss more on the same. We'll also bring you a view from the Ministry of Health Command Center with a cabinet secretary.
Hapa ndiye naishi na nimeishi kwa muda mrefu. Nimeishi na watoto wangu, niko na bwana tukakosana. Vile tulikosana hata bado alifariki. Hayuko hata sai. Lakini huyo bwana tulipatana tu hapa Nairobi ana kwao. Mzaliwa wa hapa. Sasa nilizaa na yeye watoto 8. Kwa watoto 8, watoto 3 wakashikwa na ugonjwa ya akili. Vile walishikwa na ugonjwa ya akili, nilikuwa nikiwapeleka Mathare, nikiambiwa mambo ya pesa, nakosa pesa, nikiwalilia wanasema nitoe chochote kenye niko nayo watanisaidia. Na wenyewe hata kenye niko nayo hata ikiwa ni 300 peke yake waniwaachiliangi. Wanachukuanga hao watoto, wanakaa nao wakipona, watoto wanarudi tena huku. Kwa watoto 3, kuna mmoja msichana alijichomea kwa nyumba. Wakabaki 2 na hata sai wako huko mento.
Before we dive deep into this topic, let's ask the basic question: what is mental health? And is any Kenyan aware of different medical health disorders condition? And do they really understand the concept of mental health?
WHO defines mental health as a state of well-being where an individual is able to achieve their full potential and they're able to cope with the normal stresses of life.
Mental health is a very integral part of children's overall health and well-being. And especially I would want to say that it is very important in the children's physical health.
For children, the most common disorders that we deal with is behavioral disorders. What we call, we have children who are sent from schools because they've done, teachers feel that because of their indiscipline, there has to be something that is causing the indiscipline.
Most of the families do not understand what mental health is all about, and this has largely contributed to lack of support from the families. And most of them realize that they have a lot of stereotype on mental health, and they attribute it to witchcraft, among other reasons.
The causes for mental illness are many. They range from genetic contributions. There are people who are genetically predisposed because maybe a family member had a mental illness, so it means you are also likely to get that mental illness at one time or another in your life. Other causes that lead to mental illnesses are things that happen when you're pregnant, like a mother who gets infections when they are pregnant. Early childhood events, adverse events like loss of a parent, child abuse. This can predispose you to lifelong challenges with the psychological issues and behavior.
Shida ya ugonjwa wangu mali ilianzia 1997 wakati nilipata mtoto 1995. Nikaanza kuzunguka, nikaanza kupiga kelele, nikiongeleshwa na mama ninakuwa na hasira mingi sana mpaka wa familia yetu. Nikaanza hivyo wakaona niko na shida, wakanipeleka hospitali kwa clinic. Wenye nilipeleka clinic hapa Kariobangi, ndio daktari wakaniangalia, wakasema kwanza nipelekwe hospitali kubwa. Nikafanywa referral, nikapelekwa Avenue Nursing Home. Wakati nilifika hapo Avenue Nursing Home, nikakaa karibu miezi 2 hivi. Ugonjwa hupatikani ni mgani, bado niko na zile hasira, mara nawaambia mimi ni mimi ni Wairimu Nelson, nataka kuponyesha wagonjwa wote wale wako hapa kwa hospitali. Sasa ndio wakaona kweli ugonjwa imeendelea sana na pesa inatumika mingi sana, baki ikafika mahali hii plot ilikuwa ikuje isimamie bill, kwa sababu hii ploti ni ya ndugu baba yangu, ndio walikuwa tunaishi na yeye hapa. Hata kutoka hapo ndio nikafanywa referral, nikapelekwa Madhari Hospital.
Shida yangu ilianza mwaka 2007. Nilianza na kuumwa na kichwa. Nikapelekwa hospitali kadhaa, nilipelekwa Kenyatta, nikapelekwa Mbagathi. Kwanza nilianzia na hizi hospitali private. Sasa vile nilienda Kenyatta, nikapimwa kila kitu, ikaonekana ugonjwa hakuna, nikatumwa Mbagathi. Pia huko nikapimwa, nikaambiwa ugonjwa hakuna. Sasa nikakuwa nilikuwa nashindwa sasa, kama ugonjwa hakuna inaweza kuwa ni nini. Hasa kufika 2008 January ndio nilianza na kuimba.
Alianza tu venye alikuwa amewaambia kuimba hivi, mimi nikastuka juu watu walikuwa wanasema kwa street wazimu. Mimi ilikuwa ni affect kama kijana mdogo.
Lakini vile ilifika 2012, wakati huo nilikuwa ushago, lakini nilirudi huku Nairobi. Nikapotea usiku mzima. Nilikuwa natembea tu, nikitembea kwa mabarabara tu, nikiimba, nikisunguka. Saa vile nilipatikana the following day kitu saa 9. Ndio nikapelekwa hospitali nyingine iko huko kwa Morocco, inaitwa Modern. Nikalazwa hapo Modern, nikakaa hapo karibu wiki moja. Lakini madaktari wa hapo wakaambia brother yangu ni vizuri wanipeleke Mathare.
Ni kwanza venye ilianza, nilitolewa ushago nikaletwa huko, nikaanza kuishi na stepmother juu babangu pia alikuwa ameoa bibi mwingine. Sasa pia akaanza kunitesa, but sasa venye mama alirudi huku Nairobi, nikatoka huko nikarudi kwake. Juu life ilikuwa ngumu pia huko unaambua huko nyuma, unaambua mamako na wazimu, unachekelewa, bado kuja huku ya stepmother na kutesa bado.
Ndio nikapelekwa Mathare 2012, nikalazwa Mathare miezi 2. Ndio nikawekwa kwa dawa ya Risidon na Tecrito. Nikaanza kumeza Tecrito moja asubuhi, moja saa 9, moja usiku, na Risidon moja usiku. Nikaenda hivyo, nikakaa Mathare miezi 2. Daktari mkubwa akikuja na Mathare walifanya kazi mzuri, na sasa walifanya kazi mzuri juu nilikaa huko wiki 2 na nikaona tofauti.
Since ali recover, sasa hii at least niko poa, naweza tembea bila hiyo kudhulumiwa yani. Juu ni kitu na hatingi by the way.
Statistics show that 1 in every 4 Kenyans suffers mental disorder at least in their lifetime, and 1 in every 10 Kenyans suffers a common mental disorder, with anxiety, depression, substance and drug abuse being the leading cause of mental ill health in Kenya. And with that in mind, Mathare National Teaching and Referral Hospital is an institution specialized to handle cases that have proved hard to handle both in private and public facilities across the country.
Mathare is a psychiatric institution. Here we treat mental illness. It is about more than 100 years old, having started off as a smallpox center around 1904 and as an asylum in 1911. In 1964, its name was changed to Mathare Mental Hospital and has remained as Mathare Mental Hospital under the as a department in the Ministry of Health until the year 2020.
At Mathare Hospital for quite a long time, we have been purely offering outpatient services for this particular group of patients. Okay, we currently don't have yet our own unit or department as such. We have been been accommodated in different departments.
In 2020, we are happy that the President and through the Cabinet decided to have Mathare as a state corporation. And in August of 2020, from August of 2020, we are now a state corporation and operating as a semi-autonomous government agency.
When this hospital was declared a state corporation, we are also mandated to provide integrated services. And integrated services, it means that those patients with the physical illnesses can also be attended here.
KMTC Mathare was established in 1961. We are situated inside the Mathare National Teaching and Referral Hospital, the National Mental Hospital in Kenya. And in 1961, the country was preparing to get its independence, which was awarded in 1963. So at the time, there were many mental problems in the society. During colonial times, there was a lot of war. And before then, there was the First World War, the Second World War, and the issues of mental health were on the increase. And therefore, the government felt there is need to establish an institution, that is KMTC Mathare, that would train quality health workers. KMTC has actually taken the challenge to support the government in UHC through achieving its mandate of training. Our graduates, upon completing college, they go and are employed in the health facilities in the county, at all levels, in the private sector, private sectors. And in these health facilities, they provide the healthcare services, quality healthcare services, especially pertaining to mental health.
We continue with Maisha ni Health, and today's focus being mental health disorder. We are in Nairobi County to seek people's opinions on this issue. And remember, the president earlier on had said that mental health issues is actually a challenge in the country. And according to statistics, about 1.9 million Kenyans suffers mental disorder, with Kenya being ranked the 4th in Africa in terms of leading with issues to do with mental health disease. Come with me. Unajua kuhusu any mental health disorders?
Well, yes, naweza sema najua kama depression, ambayo watu wengi hawajuangi wako nayo, ama hawajui ni shida, ama hawatambui ni shida. Na sana sana mimi ufikiria ni juu ya haya maisha ukipitia and you're not sharing. Unaona ni kama wewe tu unapitia hiyo shida, but the truth of the matter watu upitia.
Kama mtoto wangu ako na problem ya hiyo, nasikia ni kizunguzungu kwa akili, inamshika anytime, haina mahali specific, haina wakati specific, inaamuka anytime tu inamshika. Sasa ikimshika inamshika kama inamgandamisha mdomo na mkono. With 5 to 10 minutes ana recover.
Mimi nilikuwa natumia hizo madawa, lakini vile serikali ilileta hii programu ya methadone, ndio ilikuja kuturekebisha, na sasa tuko sawa. Juu mbeleni tulikuwa mbaya, juu inakaga mwenda wazimu, hata familia iwezi kukubali.
Iko na changamoto kwa sababu saa ingine mkitembea na njia anashikwa, mnakaa chini kwanza. Akiwa shule anacheza na wenzake inamshika, anatengwa, anakuwa kwa kutengwa, hawezi simama kwa parade, hawezi simama kwa line. Kitu kama hizo zinapea mtu changamoto.
Mtu akiwa na hiyo shida ya akili, unapata sometimes ni drugs, na zingine unapata ni witchcraft hivyo.
Maisha ni Maisha ni Maisha ni
When a patient comes to the hospital at the outpatient, what happens, they'll get a psychiatrist at the outpatient, and then there will be a psychologist also sitting in, especially for patients whom we feel may need what we call PFA, psychological first aid. That is an instant help that is, or an instant treatment that is offered to patients who need it at that particular point. Like there are some suicidal patients who psychiatrists might feel that this one need a talk therapy before they are taken to the ward.
In psychological treatment, we assess the patient, identify the stressors and the triggers, and there are several modalities that we use in managing the patient. We let patient take charge. Remember, they are the ones going through this issue. They are the ones who will take through the prayers, the singing and all that. We as professionals come to offer the professional point of view.
So Mathari Hospital, we are the topmost hospital, a level 6 hospital, providing specialized psychiatric services. Actually, we are the only institution of its kind in this country, and not only in Kenya. We are the largest referral hospital in East and Central Africa.
So for the patients who are not able to afford the services in the facility, we've been able to support them get these services without any discrimination. We've also been able to enroll quite a number on NHIF. Remember, right now we are talking about healthcare financing, and that each and every household is expected to have NHIF.
Siku moja nikachukulia mama akiwa amelala, nikamchukulia panga kwenda kumkata juu alikuwa ameakua alert sasa kwa ugonjwa wangu, ndio akapiga nduru, watu wakakuja wakamsaidia. Sasa hapo kufika Mathari Hospital ndio nilianza matibabu yangu. Matibabu nikaendelea vizuri sana, madaktari walikuwa wazuri sana, walikuwa wananifanyia hata counseling.
Counseling is a type of a talk therapy that is done to a person with a mental illness or a psychological issue for a short period of time. But for psychotherapy is for a longer period of time, and is usually also offered to those with serious mental health disorders.
Nikienda kwa daktari ninamuelezea, ananifanya counseling, tunaendelea na yeye vizuri, follow up za counseling naendelea nazo vizuri, pia kusocialize na marafiki zangu pia huwa tunaongea na hao. Wananiambia usikuwe na uoga Emily, huu ni ugonjwa kama ule ugonjwa mwingine, na ni vizuri kujikubali.
The benefits of group therapy is, remember we've said they share something in common. So basically they talk from experience. These are the people who've undergone that issue, and they are in a different level. There's someone who went through the same issue a while back, and they've grown, they find a way of managing that issue. They will get to explain to another person who is going through that specific issue on what they did.
We treat illnesses such as schizophrenia and bipolar, and there are some of those cases that we call refractory cases that don't respond well to medication. So in those cases, we treat them using ECT, which is basically giving an electric charge to the brain, causing the brain to restabilize. We do use it as a last resort in some patients. However, in other patients, like for example, what we call catatonia, patients who are just not responding in any way to their physical surroundings or to they're not interacting well with other people, we use it as a first resort.
In ECT procedure is to ensure patient safety because during the procedure the patient is asleep and paralyzed. So I breathe, basically it's like I breathe for the patients.
Nikikuja nao kama wapepewa ruhusa wakuje huku, nikikuja nao hiyo madawa watumiangi wanarudi wanakataa. Na tena ile kitu inawaharibu ni hizi mabanki. Wanafuta banki, wanaweka vitu zingine kwa mdomo hapa hivi. Sijui inaitwa kuber. Hiyo vitu ndio inatuma watoto waharibike vichwa. Juu wameharibika tu wakiwa wakubwa hivi, wajazaliwa wakiwa hivyo.
Tangu nianza kutumia dawa nimekuwa normal, naweza sema nimekuwa normal kwa sababu sasa zile hasira huwa zinanishika, sinanga hasira, nimekuwa mzuri kabisa. Dawa zimenikubali, nimejikubali pia mimi mwenyewe, na pia kusocialize na watu pia inanisaidia sana, kwa sababu hata mimi mwenyewe ni CHV na bado mimi ni nakuanga na shughuli za hapa mtaani, na wanakuwa wananiita kama kuna seminars naitwa, na bado sasa nakuwa naendelea vizuri.
Tangu aje hizo dawa, hata umpatie pesa enda town, hata mimi ushindwa. Yeye anaendaga Marigiti, anapadaka gari hapa inakujanga hapa ikitoka Dodora, ako na mizigo. Sijawahi sikia kitu imepotea.
The nature of our community, when somebody tells you nasikia vitu zikiniongelesha, or if you see somebody just walking in the street and they are talking to themselves, you know, there's a lot of belief in things like witchcraft around. And when somebody tells you mashetani, ninashinda nikiona mashetani usiku, the first thing, somebody will not even think about mental health.
Previously, mental health was not actually embraced in our nation. And now we can't say we're just coming to understand what mental health is. And if there's anything that actually we should have done even like yesterday, is actually embracing this knowledge.
I think COVID has come with its own blessings as such, you know, out of all the challenges that it has brought. I think it has had a positive impact in terms of creating awareness around mental health.
Kwa hivyo, ninaweza sema watu wakijua hakuna ugonjwa haina dawa, watafurahia. Juu wengine tu ni kuwasilia watoto na kusema kurogwa.
Evidently, you know, mental health disease is a major cause of ailments in Kenya, and that's why we are seeking to inform Kenyans that mental health disease is just a disease like any other.
True. Our main objective in this episode was to establish whether or not our health infrastructure is prepared to deal with this challenge, and yes, in the process also dispel myths and stigma surrounding mental health. Well, now it's time for us to take a break. When we come back, we'll be having a panel of experts to expand more about this issue and also answer questions from the audience. Welcome back. You're still watching Maisha Ni Health. Now, how much do you know about mental health? And what is the government doing towards handling this issue? Next up, we have a panel of experts and residents of Nairobi to discuss more about this matter. So yes, this is yet another edition of Maisha Ni Health, and today our main focus is on mental health. We do have our panelists here, Dr. Frank Jenga, psychiatrist, a renowned psychiatrist, also the presidential advisor on mental health. We do have Stella Waroinge, Head Mental Health and Substance Use at the Nairobi Metropolitan Services Directorate of Health, and Dr. Lawrence Nderi, the CEO, Mathari Teaching, Research and Referral Hospital. My name is Fred Indemuli, and I'll be taking you through this discussion now. Good morning, ladies and gentlemen, and karibuni sana. Now, Dr. Frank Njenga, we are talking about mental health and not necessarily mental illness. So can you take us through what mental health is so that we could get to understand what this whole discussion is about?
Okay. I think that's a very, very, very important starting point. Mental health is a state of well-being in which you contribute to the society in which you live, and is not just the absence of disease or infirmity.
But how much of a problem is mental health? How much of an issue is mental health, even in the budgetary allocation of the Nairobi city?
We all look at mental health, and I always challenge people, what's the difference between mental health and mental illnesses? So I think number one, the biggest problem we have is the information and the stigma that is associated with mental illness. How much of mental health is there, I think, is about sometimes when we go back to an individual, even before we come to the mental illnesses, how much are we doing for ourselves in terms of self-care and all that? When we come as a county, one of the main issues, and not just us as a county, even as the national government, even in the world, is issues of budgetary allocation. We have a budget, it may not be enough. However, we have gone beyond that and ensured that at NMS now, and I think that was one of the greatest achievements of NMS, is to establish the services and the structures. It may not be enough, but we are at a state where in the dispensary, about 27 of them, you can have access to mental health services by a mental health practitioner.
So what are the most common forms of mental illnesses?
We have a lot of mental illness in this country, okay? Top on the list, Kenyans, because of our socioeconomic status and whatever, we have a lot of anxiety and depression around. Cross-cutting all over. There's a lot of anxiety and depression. Then we have a lot of problems with the use of substances. Our children have a lot of illnesses that is going undiagnosed, undetected. We have very young children who are suffering from depression, but most of the people will never be able to tell when children are suffering from the depression and anxiety. And substance use has found its way all the way from primary school. It's no longer about, initially people used to think these things of substance use used to be found in colleges. But studies that have been shown have found that as early as primary school, our children are using substances, and it's very rampant.
I want to hand it over to the audience to ask questions to this very experienced individuals when it comes to this issue of mental health. Over to you, Bentura.
I'm going to take questions from the audience. We start from...
Yes, my name is Daniel Otieno. I carry a family burden of mental health challenge. For the last 4 months, I have been struggling to manage my cousin, a 21-year-old boy who had mental challenges, and it really taking a toll on me. So my question to our greatest panelist is, what plans do the Minister of Health has to integrate mental health services in our public health facilities?
My name is Evelyn Jerry. I am Miss Kavikav Kenya 2021-2022 and also a mental health advocate. What steps are you taking in educating the health workers at first? Because they are the first people that the patient is going to see in the hospital.
My name is Martha Mudoni, and my question and concern goes to you, Dr. Nderi. So, to a person who's been to Mathare Hospital for 4 years and has been into substance use, mental health and mental illness, but did not get any help. So he was discharged. So right now, imekuwa zaidi. So how would you help such a person?
I'm Wanjiru Mwangi, a student. And my question is, as a young person, how do I assess myself? Ndio niseme I have a mental illness or issue, and how do I go about it before I go to a doctor or another person like myself? How will I assess that?
My name is Sabuti Mboka. I have a few questions. Maybe I live with a child. How do I know that this child, a 2-year-old, is mentally ill or has mental issues? And my second question is, you talked about that outpatient services are free. Does it include the medication like the second generation and the opioids and the antidepressants? And then my third question is, someone already mentioned it, about how you're educating students and also health professions on how to handle patients with mental illness.
Asante sana. Kwa majina naitwa Emily Mogore Ndua. Mimi mwenyewe nakuanga na hiyo shida ya mental. Swali langu ni, je, nimekuwa mgonjwa since 1997 and now I think it is 25 years. Nilikuwa nauliza huu gonjwa kuna wakati nitafika daktari aniwachishe dawa. Bipolar disorder.
My answer will be yes and no. It depends. Like I had said before, when you get mental illness, it's a different experience for every patient. Okay? That will be best answered by the practitioner who has been dealing with her.
Question raised by Daniel Otieno. He says, talks about a family burden, a cousin who is suffering from depression or issues associated with mental illness. And he asks, what plans are there, probably at the ministry level, Ministry of Health level, to integrate mental health services into public health facilities?
It sounds to me as though your cousin needs a slightly higher level of attention than you can get at the community level. If you go today to any of the NMS centers, they will be able to give you access to an appropriate level of mental health care. Is that correct? Whether it's a psychologist you need, whether it's a psychiatrist you need, here, today and now, these things are available in this country.
Let's go to this question by Evelyn Njeri. And she talks about lack of awareness towards eradicating stigma, and what steps, she asks, what steps have you taken towards educating health workers and bettering the understanding on identifying symptoms and signs? And this, I think, is at the county level, because now you run the facilities even as low as a dispensary level. And so the training of health workers would be part of your problem. How much of an effort are you putting towards training for health workers to handle mental health needs?
Thank you so much, and thanks, Evelyn, for even being an advocate. And when we come to about education, I always say issues of mental health, it's two-way. It's about the community and the specialist. And we will never have enough mental health experts. So what do we do? One of it is start sharing and start shifting. So in the community, let me start by sensitization, because you talked about stigma. What we do now as a county, we have partnered. We can do it alone. You're part of NMS by the virtue that you stay here. So we have partnered in the youth. We have the Nairobi Youth Advisory Council, who are our big partners, who we have trained on mental health, and they become advocate. We have other NGOs that anything to do with youth, we incorporate the aspects of mental health. What do? The youth are very good with internet. They post, they have challenges. We have even youths in even places like Kenya Red Cross, where they have specifically incorporated the aspect of mental health. So I usually call it a collective responsibility. Yeah.
Okay, thank you so much for that. The other question is directed to Dr. Nderi, and this is by Martha Mudhoni. And she talks about a person who was admitted at the Mathari facility for 4 years, was later discharged, and the situation is getting worse. And she asks, how can you assist such an individual?
Thank you, Martha. You said 4 years. I may not have the details of that particular case. What I would advise her is maybe she can come to the office. We have a relook at the case and see what exactly happened, and maybe from there we would be able to advise her accordingly.
Yeah.
The other thing maybe I need to note is with mental illness, sometimes also the aftercare services that somebody gets also has a lot of bearing on how the outcome of the illness will be. You will find that most of the time, by the time we are discharging patients from the hospital, they are well, they are good. But one of the things that we need to improve on is the aftercare, the support services that once you're back to your community, once you're back to your family, once you're integrated, what happens after that? The follow-up, I think sometimes that is where we have a lot of problems, and that is what sometimes keep people coming back.
The expectation is that when we come to a hospital, you're treated, you get cured, you go home. But when it comes to mental health and mental illness, is it always possible? Can it be a permanent condition that needs to be managed going forward? Kindly expound on that.
So we have quite a range of mental illnesses, and they behave in, there's no constant for the mental illness. So you will find in some cases like depression, there's somebody who will just suffer one episode and you treat it, and for life they will never experience another episode. But you find there's another person who will suffer an episode today and then will be fine for the next 10 years. Then after 10 years, another episode can occur. So there's quite a range of outcomes that can happen. But some cases you will find that they will end up being It's just like diabetes, hypertension, just like any other disease. You will find that once you've had it, you may have to live with it, but the thing is, we can be able to manage the illness and you're able to live with it and be productive in society.
Okay.
Yes.
Thank you for that. And now a question here by Wanjiro Mwangi, and I think this one I'll direct it to you, Dr. Jenga. How can I assess myself and identify whether or not I have a mental health issue? And probably also we could tie to the other question by Abuti Mboka, who asks, how can I know that my child who cannot express themselves, she gave the example of a 2-year-old, is mentally ill?
Okay. I'll say three. The first one is that, and this is an important point, and I don't know if that camera, I want to talk to teachers and parents to say this, that the mental illnesses that will be developed, 50% of them can be recognized, yes, before children leave primary school. In other words, by the time children reach the age of 13 or 14, if the child is ever going to develop a mental illness, you should have picked it up. What does that mean? It means that the parents and the teachers are the gatekeepers, almost literally, to 50% of those conditions. And what is government doing about that one? We have already entered into an arrangement as government with the biggest unions for teachers for secondary school and primary schools, together with the TSC, together with the curriculum development, KICD, and other stake players, to actually develop a curriculum targeted at teachers in primary and secondary schools, so that they can now do what we are being asked there, find a way of ticking off. This boy has changed. He used to be a very obedient boy or girl, for that matter, but now he's the bully in the school. Is it possible that they're developing a mental health need of one sort or another? We are, as a result of the task force, many of these things come from the task force. We identified parents and teachers as the ones that need training. We are developing curricula for that one. 75% of all the mental health needs that human beings will develop are identifiable by the time you students leave university. All right? So if you can pick it up from primary school, secondary school, and universities, we as a country are doing extremely well. And what we are doing is that we are developing a curricula that will help teachers to identify this one. When we went around the country, a very interesting group came to us and pleaded with us, and we said, yes, we shall respond. And these are the spiritual leaders. The Christian churches were represented, the Muslims, the Hindus, they were all present, and they all made a plea to government as follows. Please develop teaching materials for us as imams and as priests, so that when we have engaged our congregation, we are able to recognize this one has a mental health need and this one. The demand is there and it is appropriate. And finally, to the person who now wants today to find out whether they have a mental health need or not.
Self-assessment.
Self-assessment. They're there. There are a lot. Maybe you can speak to the self-assessment tools that are available.
We have several self-assessment, but I always say the first is you as an individual. Who are you? Do you know what makes you tick? Are you that happy person? Then all of a sudden you find that you don't have interest in getting out of bed. You find yourself crying. That is, no one can do that better than you. The other one, we have now the standard tools. If you go online, look, for example, the patient health questionnaire that is there. It's called a PHQ-9. It's there. You're able to answer it. Some of them you're able to do online, and they're able to give you results. We have tools for checking for anxiety. We have tools for checking for your, there's other one that checks on your issues of your risk, activity. So self-care, it helps you to check how many hours are you sleeping, are you doing enough exercise, are you having enough like issues of diet, issues of your social support. So we have several self-assessment, and Kenya, I think we have been rated as one of the countries that has very good access to internet and Androids. So I think it's also, I always say it's also a responsibility. You're very good at TikTok. You're very good at IG. Can we also use that energy to check on ourselves? Okay. There are accredited sites that you'll be able to check that. The tools are there. Take 5 minutes, get off IG and spend 10 minutes on reading about mental health and self-assessment.
Thank you so much, Dr. Frank Jenga, psychiatrist, also the Presidential Advisor on Mental Health. Stella Waroinge, Head Mental Health and Substance Use, Nairobi Metropolitan Services, Directorate of Health, and Dr. Lawrence Nderi, CEO, Mathari Teaching, Research and Referral Hospital. Another round of applause to our panel. Yes, you've been watching Maisha ni Health, and we'll continue with a lot more after this break. Well, I do hope that now you have a better understanding of what mental health constitutes and where you can get assistance.
Mental health is a subject that affects each and every one of us in one way or another, whether it's on a personal level, within the family setup, the community, or the work environment. Listening to Daniel, Evelyn, Martha, and Wanjiro, they raised very relatable issues on the burden of mental illness in the family. One of them being the perception of witchcraft, education of healthcare workers to isolate mental health issues at the local level. They also raised the issue of the relapse of mental illness, the referral system, issues of self-diagnosis, identifying symptoms of mental illness or disorders, especially amongst children. They also talked about accessing medication and drug-induced mental illness. In terms of legislation, we've rolled out the Kenya Mental Health Action Plan that runs between 2021 to 25. This is in order for us to implement the Kenya Mental Health Policy of 2015 to 2030. We've also developed the Kenya Mental Health Investment Case for 2021 and launched the first ever Kenya Suicide Prevention Strategy for 2021 to 2021-25. And with support from Parliament, I'm glad to also note that we have got the approval for the Kenya Mental Health Amendment Act 2021, for which we are most grateful. Our next step is to embark on operationalizing the telemental health services, which is aimed at increasing access to mental health services to our population. Additionally, we have established the Kenya Board of Mental Health as the oversight authority so that it can focus on protecting the rights of persons with mental health conditions. In conclusion, the conversation of mental health has just begun. You don't need to remain trapped in your own thoughts. We encourage you to speak out and to reach out. There is a crack in everything, and it is through the crack that the light gets in. Remember also that Maisha ni Health. Let's shine the spotlight on this important issue and help others.
And in Imuli, you know, at any point in our life, we are going to be prone to a disease, and which is actually natural, and it's part and parcel of our life.
All the more reason why you should always prepare for any eventuality. Let us all register with NHIF, Waswahili husema, usipoziba ufa utajenga ukuta.
Exactly.
Join us next week for yet another informative episode. And you can also send in your questions through the email address quiz@maishanihealth.go.ke.
I'm Bentura Komboka.
My name is Fred Ndimuli,
and this is Maisha ni Health.
The way we choose to live determines our quality of life. The vices we embrace, our life may erase. Body and mind are equally important. But before you partake of whatever, seek counsel of a doctor. Do not surrender to desire, for it is easy to expire. Remember, prevention is better than cure. After all, Maisha ni Health.
Maisha ni Health.
maisha ni